Minister, my colleague has referenced the word crisis. It seems every time we have a healthcare debate now in the House, we have the word crisis cropping up time and time again. And normally a crisis is seen as something short-term, some impending, looming danger. It shouldn't actually be a situation that's been in evidence for a number of years. So I would say what we're suffering in dentistry is not in fact a crisis, but a failure to address known increasing deficits and problems. When it comes to dental care in Ireland, we have basically two streams of dentistry, similar to our national healthcare. We have the public and the private stream. And we essentially don't worry about the private because we assume that people have the financial resources to pay for it. But we don't actually take account of the people in the public system who are now waiting so long. They are forced into the private system to pay for services they actually find very, very difficult to afford. Beyond that, the three schemes that you mentioned, Minister, and essentially the DTSS is supposed to be providing dental treatments to adult medical card holders. We then have the treatment benefit scheme, which was the old PRSI scheme to cover adults that have sufficient PRSI contributions made, and finally the public dental health service, which is largely community-based and some hospital-based, supposed to treat children and adults requiring specialised and complex care. And that service is also supposed to support the national school children to have their first access and dental assessment, often resulting in the need for fissure seals, which are a great prevention for future onward tooth decay. But in addition, a statutory requirement is there for the HSE to provide emergency treatment and even free orthodontic treatment for children who have the most severe orthodontic problems. And Minister, as you know, the waiting lists for that are extending now to ridiculous lengths. It's just not even feasible for some people to consider orthodontic treatments 3 and 4 years away. So despite the lofty ambitions of these three schemes, the Department information and the published data shows a significant downward decline in the number of treatments being provided under the scheme. And I know you have given us updated figures there now in your statement, but just looking from 2019 to 2021, there was a decline in the number of overall treatments of 280,000 in the public system and a decline in the number of patients treated of 110,000. So as I say, we've seen these the difficulties coming down the line, Minister. I know you've engaged with the private sector in terms of the dentists to try and understand what the problems are, but they're actually largely based in terms of compensation, adequate compensation for the work that they were doing. The stakeholders have been telling you, Minister, that the repayment that they are receiving, as Deputy Berry has said, for the work that they are doing is just not economic, and that's why they are leaving the scheme. It's not hard to understand. And government, in their wisdom, in terms of the PRSI scheme, decided to reduce that to a scale and polish. Now, what good is that to somebody coming in who's in pain or requires an extraction, and who should pay for that? And medical card holders are finding it extremely difficult to access dentists in their own towns and regions while participating in the public payment schemes. And these include patients with very significant other health issues, Ministers, as you know, which is all adding to the overall care burden. I've got to highlight one misnomer here, Minister, and I think this needs to be addressed, which is the issue of autistic children in mainstream schools who do not get the same access to dental services as children in disability in disabled schools. That needs to be addressed, Minister. We can't have a situation like that. And these are kids, their parents are already facing the challenges of trying to access other disability services, the speech and language, OT, and now they have to go off and try and figure out their route to oral supports as well. And oral diseases, as you know, Minister, are becoming more common, and they share, as has been said already, the risk factors to obesity and to diabetes and heart disease. So our motion has basically called for a number of things, Minister, but in essence we need to address the more than 13,000 children presently awaiting orthodontic treatment. We need to get the dental checks done earlier, and we need more and more adults, and those especially with disabilities who are facing delays, to be able to access the services, particularly under GI. Beyond that, Minister, we need to up the numbers in the service. And this, I'm sure you've got back from the professionals. They've been telling you they need more nurses, more hygienists, more access to work permits. They need more people in the system, and they need to know what is the policy for the future. And as has been said already, Minister, the private sector is largely carrying the public dental quota at the moment. That is the fact of life, and you cannot expect, as has been said, professionals to go in and to support the public component at their own cost. And I know you have said recently in the Dáil here that that, you know, you are absolutely committed to finding a resolution. We had a briefing recently from members of the Dental Association. You know, I'm not sure that they share your position at the moment, so I would hope, Minister, that we will hear that there has been some kind of regrounding to all of that. Chair.